All right, let's talk about money. A sensitive subject, one you should be thinking of every day. Why? If you're not collecting enough to pay somebody to collect the money, well, you're creating another job for yourself. So not only are you the provider, meaning, what's your responsibility? You're having to determine if what you provide is appropriate for these people. So you have to be a doctor whether you like it or not. What does the chiropractic board expect of you? They expect you to be a doctor of chiropractic. Well, what does that mean? They understandably expect you to know what's wrong with this guy. Is it a potential tumor? Is it just a misaligned joint? Is it something just an osseous misalignment? Or are you dealing with a problem here? Is somebody, I don't know, is it a prostate that's metastasized to the lower back? And you think it's just back pain from a joint that's malpositioned? Well, good thought, bro, but you're not remotely close. So we have to consider as chiropractors, what kind of budget are we giving ourselves when we're sitting in front of somebody to listen to them, to give them our time, and to make wise medical/chiropractic decisions here? If you're charging $40, $60 for an initial evaluation, you're at a net loss. Why? Because if you're running a high volume, inexpensive by visit practice, you got to hustle. And if somebody's sitting in front of you, do you even have the bandwidth? Do you have the time to ask the questions that you need to ask to make a decision that is really in this person's best interest? Your patient, not yours, but your patient's best interest. So if you want to do a loss leader, as a provider, you're going to be working your ass off and thinking all day long. I don't know you already know this, but you have to assign a value to what you're providing so that you can feed yourself. Let's just be as base as we can be. If you're a man, I think it's advisable to have somebody else in your office with you. Why? I'll spell it out for you. Liability. Clue in, people. Everybody's looking for a lottery ticket. It happens. So I think it's totally reasonable for you to charge a fee where you can afford to have somebody in the office with you to give you a little bit of liability protection. So some backcrackers are saying, do it for as little as $25 a visit. You'll make money. Well, you will make money, but you're not going to make much. So let's say you're doing $25 a visit, and you're doing, let's say you're busting a move, and you're doing 50 visits a day. That's a good day for most chiropractors. Oh, by the way, the national average is significantly less. The national average is about 75 to 80 visits a week, and you're going to be doing 50 a day. But no, you're not doing 50 a day. You're doing 50 Monday, Wednesday, Friday. Why? Because you're tired. And then on Tuesday and Thursday, you're so lucky that you only have to work half a day. So on those days, maybe you do 20. Let's just go back to the 50. So what's 25 times 100? That makes the math easy. That's 2,500. So if we're going to cut that in half, you just made $1,250 that day. Let's say you're at $5,000 a week. Let's just make the math easy. 20 grand a month, $240,000 a year. Not bad for you and somebody else. Okay, you made 240. Let's say your overhead is roughly 50 to 60%. You made 100 grand. What are you doing? What are you doing? As a provider, you made 100K. Get a job. Go to work for somebody. Why are you putting yourself out liable for this $25 back crack? If you crack a rib and if they don't love you, something's going to happen. And you've got to zip through people. Is somebody contributing to your 401k? No. You're a sole practitioner. You're an employee of your corporation if you're really bitching. There's no contribution. It's you contributing if you're the owner of that business. You also have to pay for your health care. You got to look out for yourself. You don't get any paid sick days. These are things we have to consider. So we have to start thinking about what is a reasonable amount that I can charge these people. And that I can, at the end of the day, at the end of the year, I can have a little dignity as a man and a woman, as a provider to my family, to myself, to me. How can I have a little dignity so that I can continue doing this thing, helping people and being a valuable and an asset to the community?